Good afternoon. My name is Corina Herrera Loera, Public Information Officer with the Emergency Operations Center here with the County of Santa Clara. Welcome. Today we are marking our 2-year anniversary since the time when we initially began our shelter in place and this pandemic. So we have put a small slide for you to take us on that journey of when we first all were directed to shelter in place. Gloria Pacheco helped us put this together. Thank you so much, Gloria. And she's going to support with the slides. Next slide, please. So as we remember on these dates, we didn't know what it was. We knew the name. We knew COVID. We had heard by this time maybe as many cases that fit in both hands had been counted and accounted for in our county. We had heard about China. We were seeing the news and we were seeing different countries beginning to be affected by COVID. January 31st is when we may have started hearing about it, but it wasn't until here in Santa Clara County when we were asked to shelter in place. At that time, we probably didn't know much about the symptoms, but we definitely learned about them as we continued to hear on the radio, on the news, and even from family members who might have been affected by it. If you can take us to the next slide, Gloria. And so most of us remember tuning into every press conference that Dr. Sarah Cody had. And this specific one was when she asked us to shelter at home. Again, didn't know too much about what was hitting us at that time. But knowing that it was serious enough to shelter at home. We remember the news covering things like no toilet paper at the stores. I remember, my husband going to the Home Depot and, the grocery stores to stock up because we didn't know what was coming our way. But what we did know is that we had a strong leader in our county, Dr. Sarah Cody, who took the lead and placed our county in shelter at home. And, from there on was one of the leaders that many across the country, across the nation, actually listened to and watched. So we thank Dr. Sarah Cody for her leadership and keeping us healthy here in Santa Clara County. Next slide, please. And so there was different organizations, there was different departments that were established to investigate, to ensure that our public had the information they needed. We had the contract tracing in place, if you all remember that. Which was a group that was solely focused on tracing where the new cases would come up and then ensuring that they would trace where those new contacts, those new cases, the people that had contracted the COVID, where they had been, so that they can make sure to call them and inform them so that we could take a hold of COVID so that it didn't spread. Next slide, please. And so we remember that there were different shelters that remained open. There were different city organizations as well, city teams that came together, county, city, government, such as also the schools. There were trailers also provided to temporarily support with the shelter of the homeless. We had schools providing lunches, and I'm sure our guests will be speaking on that in a little bit. But we all came together to figure out how to best address the needs of our community during that time. Next slide, please. And so we had COVID dashboards created. These are pages and places that the public didn't have before. We didn't have, this SEC COVID dashboard, obviously. And so some of us were tuned in on a daily basis to see the numbers as they grew. If you might remember, I know I was one of the ones that was logging in the numbers in the beginning from like 2 to then 3 to then 6. And then, since then we've been keeping it up. And unfortunately, we're at so many more cases. And unfortunately, also, we've had so many other deaths. And we acknowledge that each of those that have passed away are not just a number. It's not just a number of deaths, but it's a family member, it's a community member, it's a chair that is now empty at a dinner table at your home. And so we honor them at this time, and just wanting to hold just a moment of silence for all those that passed on during COVID, because of COVID. Thank you. Those of us who did lose family members to COVID, it kind of, I know for me, shook us up, to a new reality, and like, oh, wow, we'd see it beyond our home, our families on TV. It still felt distant, but when it hit our families in that way, it really just did, at least personally, shake me up to say, even though I worked here, but it hadn't hit me. And when it did, it was like, this is serious. And so we did all we could to come together to inform our communities in bilingual, bicultural ways. We had a language access team that worked diligently to translate materials well in various languages, such as Chinese, Vietnamese, Spanish, Tagalog, doing our best to inform our communities in what to expect, and what would keep them safe at the time. Next slide, please. And so we learned ways of keeping ourselves safe. As I mentioned, we had the masking, we had the washing our hands, our remaining social distancing was a new also a word added to all of our vocabulary, the 6 feet social distance. So we made sure to do our best to get this information out in the many ways. And you might have seen this poster in many offices and many restaurants in the various languages that I mentioned. Next slide, please. And, we learned what is essential, right? As I mentioned, when, we were told we were going to shelter in place, go to the grocery store, what do I need, right? We learned those things that we need and the things that we want. And then, we also lived the time, if you remember, where, there wasn't restaurants open. And, the places that were essential workers, it was another common word added to all of our vocabulary, essential. And as we learned during time is really, that we're all essential in one way, shape, or form. But, learning how to live without the wants and just really, maintaining the needs. And then also slowly transitioning, whether it was back into reopening places and spaces such as restaurants, even the playground at a park. We were all anxiously waiting. And then, as you all remember the journey that we took, it was like things would open up and then we had to close down depending on the numbers and the surges that happened. But all that, again, keeping our community safe and ensuring that the rest of us, those of us that were alive, that continued to be alive, and that we kept as many community members alive. Next slide, please. And you remember we had various different mobile testing sites. We had appointment-based testing sites, pop-up testing sites, free at-home tests. We made different videos providing guidance on how to test and ensuring that we had accurate test results, because we, even though we provided maybe the home tests, if we didn't know how to take them, we want, then there was not going to be a reason for it. So we wanted to make sure that our community knew how to do this the right way, so that we could get accurate tests from those test boxes at home. And we did our best to provide as much testing throughout the county for our communities in the various areas. Next slide, please. And you all remember the first COVID vaccine that came out about December of 2020 here. Was about the time where the first vaccines came, where some of us might have second guessed it and maybe thought twice before getting that first dose. Some of us were lining out the door ready to get it. And there was everybody else in between. And, now, as we know the journey that we've taken, our county has provided, these are the numbers as of March 10th, 4,278,206 cumulative doses in our county. And so thank you to all the staff, everybody that came together, all the volunteers that came out, but mainly the various staff, from county staff to school staff, to all the other areas. Some libraries were even turned into vaccine sites. Everybody that supported each one of these doses that were given during this time. Next slide, please. And then you all remember the different risk levels that the CDC, that the state of California gave us. We're initially, we were on the highest risk, and learning the different ways to get to the lower risks, and knowing that we were all doing our part in order to get to that next level. Next slide, please. Then the booster came, and again, some of us, if not most of us by that time, were ready to get the booster because we knew that we had been saved from acquiring COVID or having severe symptoms. So the booster came, and many of us got it, if not most of us. Next slide, please. And we learned how to celebrate differently during this time as well. If you all remember, we had birthday celebrations from home. I remember the Father's Day where I had to FaceTime with my dad, and not have any contact with him, and, do Zooms, Zoom birthday parties instead of in person, and just get creative, drop off gifts at the door with our time away from our loved ones, to keep them and ourselves safe. Next slide. And how could we not forget, especially those of us that are parents, the schools, the empty classrooms, knowing that one day, the students were at school, and the next day they were just told, grab your bags, you don't know if you'll come back, and just left to leave an empty classroom for several months. And then when we came back to school the following school year, some schools didn't come back. And schools looked very different for those that did, whether it was plastic shields separating them from the teachers, whether it was having to wear face masks, eating outside, just many changes and changes and transitions that our children had to do and experience at school, in order to maintain safe. And I know that our next speaker will talk a little bit more about that. Next slide, please. And then we also remember, going through different situations that many of us, felt strongly about and went out to advocate, and as a county, we held that very serious, and also wanted to make sure that people were able to voice their opinions and go out, and also share tips for being safe while doing that, because definitely it's important to voice our opinions and our thoughts, and also very important to keep ourselves safe. So we did our best to also keep our community safe during and healthy during that time. Next slide, please. And as I mentioned before, our celebrations look differently. We unwrap gifts virtually, instead of next to each other, in front of each other through our screen. There were some celebrations that had to be canceled or postponed to a later date. And some we just decided to, continue to celebrate, and that it would look a different way. We got creative with our children's birthday celebrations, inspiring maybe art, on screen, hiring artists that would guide our children through an art project, and doing our best so that our little ones could live at least as normal as could be during this time. Next slide, please. And then, luckily, we all worked hard, went through that entire 2-year journey. And finally, more recently, as we all know, we met the metrics. We met the check marks there in order to lift the face masks from most areas, from most places. Although there's still several places that, continue to have the face masks, such as long-term housing shelters, especially for the elderly, the jails, different public places such as libraries, I believe, still have them. But many of us continue to choose to wear our face mask when in a public setting, to continue to stay safe. But we have all done our part to get to where we're at today in order to be at this place where we're able to not have to wear our masks in most places. So thank you to everybody who contributed to that. Each and every one of you who joined us, at these community forums, each of you that joined to listen into the press conferences, who stayed on top of the posts of the information, and that also spread the word, of the truth, right? And help us in dismantling myths that might have been out there, and at the end of the day, to continue to keep our families and our communities safe. Next slide, please. And as we know, these are our current numbers here. We continue to update our dashboards as we get the information from the state. As we also know, because we're in a much better place, a lot of our offices, our disaster service workers are being disactivated and heading back to their home departments. So you are going to slowly see a transition and a shift back to where even, if you can go to this next slide, even our, I'll mention it at the end or share it, but even our community forum will be held monthly now from here on out. However, very important, we're still not out of COVID. COVID still exists. It didn't just disappear. So I want to make that very clear, in that we continue to monitor cases, and you and I should continue to monitor our symptoms, our family's symptoms, our children's symptoms. I won't go over them because you've heard them over and over. You know what they are now, but they are on the screen in case you need to review them. But know that you can still get tested. We do now, the new order directs our public to go to your health service provider. So if you have Kaiser, go to Kaiser. If you have El Camino, go to El Camino. Go to your service provider to get tested. If for some reason they are not providing testing for you, then we do still have testing sites. And you can find that at www.sccfreetest.org. And we also want you to report if there are any issues of when your service provider will not test you, if you've been exposed, and if there is a need for you to be tested, they should be testing you at your health service provider. But if not, there are still resources through our county if needed. And again, you can find that at www.sccfreetest.org. Next slide, please. And as I mentioned, we are going to be transitioning this community forum to a monthly community forum. We were having them on a biweekly basis. And so just inviting you to continue to log in on a monthly basis now. And then also, use social media. Let us know what you're interested, who you're interested in hearing more from. If, the doctor was somebody that you enjoyed listening to, if you, having somebody to come and talk about schools and updates, mental health, if there's anybody that, you feel that would be a great guest to come and update our community and have conversations and answer questions on this live forum, please let us know. We're happy to hear from you and incorporate some of these suggestions that you all might have. And so with that, I believe that's the last slide, Gloria. Is that true? Yes. So with that, I am going to welcome our guest speaker for today. He's been here before. Many of you, if you have tuned in before, have heard him speak. And this is Dr. David Putney. He is an administrator for special projects at the Office of the Superintendent, Santa Clara County Office of Education. Welcome, David. Let's bring him on to the screen. So I hear an echo now. I'm going to put myself on mute, David, and let you take it on from here.
Can you hear me all right? All right, great. I'll try to get a little bit better angle here. Thank you so much, Cardina, for having me. I really appreciate this opportunity as a colleague and as a fellow responder to COVID. It's wonderful to have this forum and opportunity to share information with Santa Clara County residents and kind of the greater community. I really appreciate your overview of kind of taking us back through our response to COVID-19, kind of from the early days into our current level of implementing a response to COVID-19. So I can't believe we're coming up on the 2-year anniversary. It feels like 2 years. It also feels almost like 20 years. Like we've been doing this forever. And it's just amazing. But we're going to continue to work together to improve our schools and our community to be safe. As I look back at some of the key essential milestones, if you will, of our response to COVID-19 here in Santa Clara County, I look at it through kind of the lens of like 4 different groups or 4 pillars. Right in the beginning when COVID was emerging in early 2019, 2020, and we moved into an awareness that COVID was a significant threat in our community, and the governor moved us to a shelter in place, and schools were all moved into remote learning. I was responsible for running multiple schools in the county, and as a first responder in that environment, helping schools transition to distance learning was a dramatic and a heroic step for our schools. And I just want to take a moment to appreciate and applaud all the teachers and secretaries and classified staff and community members, absolutely, for really, one, not only taking care of their own emotional response and doing their best to be able to be safe themselves, but to really move the school environment to a really effective learning environment online. I'd like to appreciate all the school administrators and district staff, superintendents for really holding the leadership together through these very challenging and uncharted times. We haven't had a pandemic for 100 years, and the world was dramatically different 100 years ago. So in our modern world, our leadership team in our schools really responded so incredibly heroic to move schools to a safe place online in the digital world, to ensure there was devices and computers. We deployed hundreds of thousands of devices in Santa Clara County to ensure that as many, if not all, our students had effective technology, hotspots, and access to internet. It wasn't immediate. It did take us some time, but I just want to applaud all those efforts in district leadership, private schools, and charter schools as well. Another huge appreciation and thank you is to the parents for being so involved in their children's learning, and to really be partners in facilitating learning through this pandemic. And still, many families are still actively helping their children at home. Huge appreciation and respect for parents and community members, uncles, brothers, sisters, grandparents that stepped in to be educators at home for the little ones and to provide childcare for the little ones. So again, I cannot thank you all enough for being so important in helping raise our children here in Santa Clara County. So the first bucket of information, I kind of look at through the responding to the immediate threat of COVID. As that went through the end of the academic school year and we did graduations online or drive-by through graduations, again, there's such new uncharted territory. As we moved into the first fall of COVID-19 in our school environment, we worked through partnerships with the California Department of Public Health and developed a waiver process to where we could work specifically with schools that were prepared to open in person with new mitigation strategies. It was very challenging. We worked in orchestration with schools and CDPH and our local Santa Clara County Governance and Emergency Operations Center to ensure that all the safety procedures were established. Many school districts across the county applied through the waiver process and were granted the authorization to open and move towards a daily instructional model. That was a phenomenal response. Again, it was kind of like the early movement towards getting back to school instruction, in-person instruction. And that was just a huge milestone in this pandemic. As the year continued, we moved into a level of more and more schools opening. The guidance changed. And I'd like to pause there for a moment. I think it's important to recognize how challenging that the pandemic has been, and that this is new information, new technology, new science information is constantly emerging. And so it was a two steps forward at times, and then we'd have to pause and recalibrate based on new information that CDPH, working with the CDC and the World Health Organization, and researchers from around the world looking at new information and constantly refining and constantly retooling how to respond to COVID-19. It's very challenging. And so in that process, there'd be times that the guidance would emerge and it'd be confusing, it would be challenging, and schools and families and community members didn't understand it. And I just want to acknowledge how difficult that was and appreciate everyone being part of the solution, working through that process. I talked to thousands of family members, thousands of schools on a regular basis, responding and answering questions based on what they were trying to understand, and very tough. And so that process will continue as we move through COVID-19. We have more momentum now, which takes me to the next column. So we kind of have another chunk, which is then as we moved into the second semester of last academic year, we had a lot more movement, and we kind of emerged into trying to get to daily life, schools reopening, businesses reopening. The blueprint for a safer economy came out. It gave us the opportunity to reopen and lift sanctions and lift closures for different sectors in our community and emerge back to a more normal daily life. And then again, we had new variants come in that challenged us with Delta and Omicron, and that took us back to where we had to recalibrate with some additional science. Moving into the next bucket is really this era that we're in now, that we have a greater sense of knowing how COVID truly reacts in our community. We have schools that have been supported and understand the mitigation strategies that include, but not limited to, masking and hygiene and proper hand washing, understanding what a close contact is. Now with Omicron, we look at close contact as sharing indoor space with someone for 15 minutes or more. Back in the early days, it was within 6 feet. Now we understand with Omicron it spreads faster, so it's more of a sharing airspace indoors for 15 minutes or more. And so knowing that, we've moved into a level now where schools have these mitigation strategies that they can effectively use based on their local experiences. The conversations with California Department of Public Health through our school liaison team has really given us the understanding that really they've developed these new mitigation strategies that we've really been working on for the last 2 years, and empowering local county jurisdictions and local educational agencies to make decisions based on their local experiences. If we think of the state, a huge state, geographically large area with many different communities, it's difficult for CDPH to be able to drill down specifically to what's occurring here. That is why we have Santa Clara County Public Health Department under Dr. Cody, who provides such clear guidance and local guidelines here when appropriate to help guide the conversation and to guide our responses. And now local education agencies are supported with California Department of Public Health to use these mitigations based on what they're experiencing. So for example, in the county, some schools may have a high vaccination rate with employees and with their students and families. Other parts of the community may have lower levels of vaccination rates. Those mitigation strategies may be applied slightly different based on the different events that the school has to ensure that they can at least mitigate to the best of their ability to provide effective strategies. So this is now this transition to moving into living with COVID-19. So we're at a point in time that we have a lot of learning and momentum. We're in unknown territory still with COVID-19 because we hope there's not another variant, but it's very likely that new things will emerge and new things and challenges will occur. But we're now learning to live with COVID-19 in our schools. I want to applaud all the school employees, the leadership team in the schools across the county, all public, private, and charter schools, for having significantly effectively engaged in mitigation strategies and had significantly low COVID transmission in their schools. The majority of the COVID that came to the campuses of our schools were really community spread, and they showed up at schools where testing was occurring on a regular basis. Transmission in school was so minimal to very minute levels. It shows that schools are really the safest place for children in our social communities, and where teaching and learning is the best place for students is in person. So huge applaud to all the teachers and the staff, the administrators and the leadership team, management and school boards, because it's been heroic to get to this level. So as we move forward, now it's going to be, let's finish the year strong, and hopefully we can continue to prepare for new information and new science from our partners with CDPH and with the CDC. And community forums like this where we can answer questions and give you accurate information. That is our goal. If you have questions that come up, please reach out to us. We've all been here through the duration of the pandemic, and we're going to continue to support our communities because we really love and care about our children and the safety and the welfare of our entire community. So schools, I think, I'd like to say that they got a A+ for working hard this year. Parents, I think you got a double A+. Being a father of two, I know how challenging it is to take care of our children and to be having class in your homes when you had to go to work. That was tough, really hard. And if you had to leave the home to go to work and had to look for childcare. So again, A++ to parents and community, extended families to supporting our children, and again, A+ for our schools. So thank you so much. Karina, that's kind of what I was looking at as the overview when I think of where we are, and hopefully this next chapter we'll move into the 22-23 school year and be even more prepared, and hopefully we'll just stay 2 or 3 steps ahead of Omicron and future variants.
Thank you so much, Dr. David Putney. And I want to take advantage of his time. So please, if you have any questions for him, I do see a couple in regards to school. So I'm going to go straight into the questions to take advantage of this time with you. Thank you so much for being here with us. But before we go to the questions with school, I do have Kimberly Murphy here. Thank you, Kimberly. And she is wondering about how there's different questions she puts, but overall, she mentioned, I have constant fear everywhere I go because people are unmasked, coughing and sneezing like there is no business. I have been attacked since day one for wearing a mask, but now I'm constantly bullied for wearing one. What are you going, and I think to do? So she's wondering, how are you going to protect those of us that are at high risk while dropping all the protective measures? Very good questions. And the only thing I'm going to say right now is we've been doing it all along, which is a part of the vaccines, which is a part of, the booster shots, ensuring that we get tested, ensuring that we know not just if we have COVID, but what to do, how to quarantine, what does that mean, where do I go, even resources. And so we're doing our best, and we all know that each of us are going to respond differently, and we cannot control people's response. We can just control ourselves. And so thank you so much Kimberly, for, following, sounds like, following the orders, ensuring that you're safe, for doing your part, and just hoping that, people continue to do their part. As I mentioned, even though, we don't have to wear our masks, I continue to, whether I get bullied or laughed at or not. At the end of the day, it's making sure that we are healthy and we are safe, and that we are keeping each other safe. And so I'm going to move a little bit forward, and let's see. Focus on a question in regards to, let's see, we have TV Real Alarcon. I have a question. I understand how we are no longer required to wear masks, but what is that if you're in a theme park? Why are we not required to wear a mask if you're on a ride? Isn't that a high risk level cost? Good question. And I'm not going to speak on all the theme parks, because I'm sure that they all have their own policy in regards to face masks. Some that we might like and some that we might not. And so, again, it's really going to be up to ourselves sometimes to keep ourselves healthy and safe, and maybe even choose not to get on some of these rides if that is best for you and your family. But thank you, T. Villarreal Alarcón. And we have another question from T. Villarreal Alarcón. We will need to be vaccinated next school. Will we need to be vaccinated next school year to attend? And what about the new variant? Will kids need to wear masks again? So I'll leave that one up to you, David.
Great question. There has been a decision through the governor's office and also through the California Department of Public Health to have vaccines be part of the expected vaccination requirements to attend school once the vaccine gets full authorization. Right now, full authorization for the Pfizer vaccine is for ages 16 and up. We anticipate that they'll continue to review it, and at some point it'll go to the lower ages. The way the order is written is that once there's full authorization for students in specific age grouping, so secondary, for example, grades 7 through 12, is usually around 12 to 18, is kind of the common age group. When the vaccine gets full authorization for that age group within the secondary environment or within that grouping, the following July or the following January would be when that expectation and mandate would be rolling forward and be part of the expectation to enroll for in-person instruction. So for example, if the full authorization occurs this springtime before the end of June, then July 1st it would be in place for grades 7 through 12. This is the current plan. Now, as we know, things occasionally have changed moving forward. If the full authorization from the FDA is approved in August or September, then it would be starting in January. Then students in grades 7 through 12, ages 12 and up, or depending on the grades, the age span of the full authorization, would then dictate that that following January would be when that mandate would be in place. Now, this is through an executive order and with California Department of Public Health, so there's a couple nuances to it. There is conversation that is going to move into more of a legislative decision. At that point, then it would have, again, just some minor nuances, but it's anticipated to go in that sequence the same way. I think we should just kind of anticipate and pay attention to news information that comes out from the governor's office and from the state and our county, and we'll definitely be informing folks as that becomes more clear. In regards to the new variant, and will kids need to wear masks again? CDPH strongly recommends that we wear masks indoors. That is their current recommendation from the California Department of Public Health. It is one of the mitigation strategies, and schools may independently add on additional requirements if they choose to, or additional mitigation strategies. So a school may decide locally that there's a lot of community transmission of COVID-19 in their local community, and they may, through their own local education agency, decide to add the mask requirement back on into indoor person instruction. So it's difficult for me to say, will masks come back or not? The state of the county could also choose that jurisdiction if Dr. Cody and our public health community here felt that the rise of COVID in the community warranted the need for the mask. because we've seen that the mask is one of the most effective strategies to prevent transmission of COVID-19. So our local community, local health office could make that decision, and or the California Department of Public Health at the state level may make that decision. So it's kind of like looking into a crystal ball. We're not quite sure exactly what it's going to look like this next year. We just know that masking has been a very effective technique to mitigate transmission, and it's very possible that it may be used again.
Thank you so much. And this muting off and on, I just want to make sure that our audience doesn't get the echo on their end. Thank you so much for that answer. And actually, thank you, TV Villarreal, for being so much a part of today's community forum. We have another question from TV Villarreal Alarcón. Since we are not out of the woods yet, will students in the upcoming school year still be using Chromebooks?
Technology, I cannot imagine schools not moving forward with consistent use of technology. Some schools are using Chromebooks, some are using laptops, some are using different devices. A lot of students use iPads or tablets or their phones. So technology in schools will continue. I hope that schools continue to manage and support students, access to technology in the event that we had to do a shelter in place again, and if we had to do remote learning. So I would imagine that those tools will still be effective and available as necessary. And as we consistently move forward in technology, we've only seen that technology plays a greater role in our lives, and that these devices will continue to be a significant tool within teaching and learning in our schools.
Thank you so much, David. And as of now, those are the only questions I see. If I don't see any others, I'm going to wait a few seconds here. Put in your question if you have any for Dr. David Putney. I'm here from Santa Clara County Office of Education. Thank you again, Dr. David Putney. And seeing none, I'm going to go ahead and see, do you have any closing words that you want to share with our audience, with our community today?
Yeah. Well, great. Thank you again for this opportunity. I think, again, I just want to appreciate all the school community folks and the parents and the community supporting our students. It really does take a village to raise a child. And we have lots of wonderful families and schools in our community. So I just want to appreciate and acknowledge that. And the leadership of our leadership team, our county superintendent, Dr. Marianne Dewan, is doing a phenomenal job of supporting communication and coordinated support through the county. We've networked with all the private, public, and charter schools in our county, and we work directly with the California Department of Public Health. So I just want to give a big acknowledgement and appreciation for those leadership teams. Moving forward, I would say just encourage people to go to accurate sources of information: California Department of Public Health, CDC, Santa Clara County, just to consistently watch and understand what's going on with COVID. And know that local situations are slightly nuanced and different because of the local control and the nature of how government works in our country. We live in a democracy, and we have local jurisdictions all over this wonderful country of ours. And sometimes it seems messy, and sometimes it seems really challenging, but really it's a beautiful illustration of communities working together, working through discourse and challenge, and working to better learning and responding. And through that, I think California shows that we've had some of the lowest significant impacts from COVID-19 when you look at the rest of the larger states in our country, and our schools have dramatically responded very effectively due to the great leadership from the California Department of Public Health and our governor. And regardless of where we fall in politics, the reality is we need to work together to learn how to respond in this modern age to this real pandemic, and we're going to become better and stronger because of it, and continue to help our students grow and thrive in Santa Clara County and our great state. So again, thank you all. Please continue to be part of the solution, and I respect you all.
Thank you so much. And thank you for coming out and keeping us informed when it comes to schools. Again, I think today, we heard various themes, but the ones that pop up the most are, respect, right? Respect yourself, respect others, spaces and places. If you want to wear a mask, if you don't want to wear a mask, as long as we're keeping others safe and, following the guidelines of wherever we want to go in. If we want to go into a store and they have that, face mask, then we get to wear it. If we don't want to wear it, then obviously we probably don't have to be in that store, and that's fine. But ensuring that, we respectfully move forward as we continue to hopefully put an end to this pandemic. And, it makes me happy, as a mother of a 13-year-old who strives, and thrives out of playing and being with her peers, to continue to have our schools open. Thank you, Dr. David Putney, for your leadership, Dr. Dewan for her leadership. And, as you mentioned, everybody else that has done their job diligently to ensure that our children have a place to learn, have a place to thrive and play, and do all the things that our children should be doing at schools. And, I look forward to continuing to serve our community, our county. Again, please communicate with us. If there's, again, a speaker, a guest, a topic that you would like us to cover in relation to COVID-19, we're here, to assist you. We're here to serve you, and do our best in continuing to end this pandemic and ensure that our county here, our residents are safe, are healthy, are living, are thriving, and doing all those wonderful things that we all love to do here in our Santa Clara County. Thank you again. And we will see you in a month, as I mentioned. So I think the next one will be April 13th, which is 4 weeks out. And until then, stay safe. And thank you again, Dr. David Putney, for joining us this evening.